Hey everybody, it's Dr. Nicole Friels here. I have a gentleman coming in for his first appointment to have his nails trimmed. I wanted to share this one with you because he was mentioning to me that the other physician that he was going to was, it was bleeding, you said, just about every time.
Yeah, he would cut into the skin.
Yeah, you got to be really, really careful. So if you're ever experiencing that, or you're having someone at home and the nails always bleed, that's not normal. So make sure you pay attention to that. And I kind of wanted to give you a little tutorial on how to do it correctly. So follow me. We'll start here. If you just kind of want to relax your foot for me, and I'll take care. You know what I'll do is I'll push this in just a bit so we get those heels dropped off. Perfect, right there. So really important, number one, you have to have the right instruments. You know how they say with a chef, or people that, amateur chefs I should say, cut themselves is because the knife is too dull. Well, that rings true to trimming your nails. You definitely want to have the right instrument. And when they get thick like this, you really need a bigger nipper. And I know everyone's like, why are you holding the nippers like this? If so, please see the other video which mentions why I do this. All right, so what I'm doing is really kind of paying attention to where the skin comes out. And I remember my friend Brooke from podiatry school, she had also skin that came out underneath the nail, and it's really hard to see. So you just want to take your time and kind of, I always give it like a gentle nudge to make sure, because you'll feel it if I've got the skin in there.
I've noticed there's some skin, it sticks out underneath the nail.
Exactly, so you just want to kind of take your time. Not much on that one, but this one's pretty long. With a long one like this, I usually go straight down, and as you can see, the line, oop, they're on the floor. Sorry, ladies. And then makes it a lot easier to get in, and you never want to grab one big bite. You're almost guaranteed, and I'll show you in just a second, if you grab one big bite, that skin is inevitably in there. I know some of you guys love the flying toenails. Sorry, I don't do that. I don't want it in my hair. Okay, and you can see the buildup under here as well, so we'll be able to really clean all of that out. So same thing, start at the tip, go back, and then this is great because whenever you twist it out, it comes right out of those corners, and those corners get extremely painful. How you doing up there? No bleeding so far, right? I shouldn't say that, right? I want to jinx myself. Here we go. Okay. Just crumbles. You know what? Before you come in next time, would you do me a favor and just soak your feet really good with some warm water? Maybe if you've got some Epsom salts hanging around, that's going to make it a lot softer, and that's more comfortable for you. A lot of people ask us why we don't soak them. It's honestly, it's a cross-contamination issue. And I know in Canada, I think they do. But in the States, we used to use something called a whirlpool to debride wounds. My grandpa actually did that, but we don't do that anymore because of people getting bacterial infections and fungal infections and stuff like that. So
yeah, I used to have one of those foot soakers that had the bubbles that come up.
That's I'm going to scoot you over just a little bit here. Perfect, thank you. So we can do this every couple of months if you prefer through your insurance. How long has it been since you had them trimmed?
It's been a few months since I did them last.
Okay.
Some of them I get better than others, while some are longer than.
Well, you know what? A lot of that is due to, well, number one, the thickness and the tool that you have, but also a lot of people have better range of motion in one hip than the other. So when you're trying to really pull that leg up there, you're going to get one easier than the other. Plus, we've got a bird's eye view here. This is a lot easier for us to do it. We're almost there. This one kind of cracked on you.
Yeah, the way I was doing them, I was trying to get the toenail clipper and angle it from the bottom up, so that kind of like this at an angle. So I was clipping up like that.
Gotcha. Do you ever have any itching down here to your feet?
Not really.
Okay.
Just cramps. There's times I will get a cramp in my foot, and my toes go at a 90-degree angle.
Oh.
I mean, literally, it's a 90-degree angle. My big toe is sticking straight up, or it's cramps so bad.
Gotcha. That, because we talked about before we started filming your balance and flexibility and how important that is, and how when you're walking it's almost like you're walking in a high heel because you've got sorry that's how close she is to me. But that creates just so much instability when the ankle contracts. It actually forces your foot inward like this. And we were going over your x-rays. You've had fractures on the outside, the fifth metatarsal, both sides. Let's go ahead and start dremeling.
Now I can tell when I'm walking, I'm kind of walking more so on the outside of my foot.
Yeah, exactly. And that's just makes you prone to sprains and falling. I see you have a cane.
Balance and stuff. I've gotten to where I have really bad dizzy spells when I stand.
Uh-oh.
But the cane, especially going up and down the stairs, the cane supports a little bit.
Now with the balance, we do have a fall risk program that we can put you through. It's basically a 30-minute evaluation of, where you are, what could be contributing. Medications can cause that sometimes.
Right.
So I'm happy to get you an appointment in there, and we can kind of dig a little more to see what's going on. Do you feel any of this?
No.
So we did a monofilament test, which evaluates for neuropathy, nerve damage, due to his diabetes before we started filming, and he didn't feel anything. Most of the time you feel a little something.
I can take out.
Really, really want those diamond head disposable spurs. You've got, and we'll pop over to the other side in just a second, but you've got some kind of dead skin, some plaques that have built up on the big toe. I'm going to call in a cream called Lachydrin. I'd love for you to use a couple times a day at first. And then you can probably just use it once daily after we disrupt the pattern of that dead skin continuing to build up. In addition, if you're watching, we have Heal, which has urea in it. That's through the Mod Pod line. We'll put a link below. But that will help what we call enzymatically debride, or just eat away the dead stuff. That's what I like to call it. All right. How they feeling? Oh, that's right. You don't feel good. Never mind. Well, they look better. How about that?
Yeah, they look better. I've got a 50-50 chance of seeing that due to only one eye.
Well, the good news is there is no bleeding, not one little drop. Perfect.
There was one side was clipping and myself and tore it, and by the time I got from the couch to the bathroom, it looked like I had stabbed somebody.
Oh God!
They was so much.
Oh yeah. All right, get you all lotioned up, and then we'll let this sit here and dry for a minute before we get your socks and shoes on. Okay. One more. All right, guys. Well, thank you for watching another edition of A Toenail Trim. I hope you learned something. Don't forget to comment below, subscribe to the channel, and I'll see you next time.